in West Little Rock. Again, this is a live look at the Arkansas Department of Health. We are awaiting a news conference scheduled to begin at 2:30 as we listen in now to hear what they have to say.
Provide this opportunity for you to ask the many questions that we're sure that people have. I have with me Dr. Nate Smith, our Secretary of Health, and Dr. Jennifer Dillahay, the Arkansas Department of Health Medical Director for Immunizations and Outbreak Response. They're going to give an update and then we'll take questions. Thank you.
Thank you, Meg. Thank you all for being here. I'd like to quickly review what we know. As of this morning, we had one presumptive positive test for the virus that causes COVID-19, the novel coronavirus. This was from an individual who is hospitalized in Pine Bluff. We are still gathering information. At this point, we think this might have been acquired through out-of-state travel. We have a team on site focused on identifying others who might have had contact with this individual and would need to be monitored or possibly tested for secondary infections. A couple things to point out. First of all, this is not unexpected. We have over 35 states that have already reported infections, and that includes most of our surrounding states, so we've been prepared for this, actually actively looking for potential cases. Second, we are on site. We're doing the appropriate contact tracing to identify any possible secondary cases. And third is, at this point, we don't have any evidence of spread of COVID-19 in the Pine Bluff community or any place else in Arkansas. We'll be looking for evidence of that, and if we see that, we will recommend appropriate actions at that time. I have with me Dr. Jennifer Dillahay, who's our Medical Director for Outbreak Response and Immunizations, and to evaluate and investigate this situation, and then we'll take questions.
Good afternoon. So I want to talk about what we're doing to handle this case and the potential for an outbreak associated with it. First of all, we're working very closely with the hospital to identify any hospital personnel who may have cared for this patient or come in contact with this patient to identify what risk level of exposure they may be. It could be high, medium, or low. And the actions that we would recommend for them would be different based on their level of risk. And then we are working to identify any close contacts of this patient and where they have been in the community, travel they have received, or health care that they might have received in the past weeks. And with that information, then we will be able to identify other people who may be at risk for the disease, and then we would recommend quarantine for them based on high risk or medium risk. If they are low risk, then quarantine would not be recommended. So I don't know if there's more information that people would like to have. We could take questions now.
What classifies somebody as high risk or medium risk?
Well, it depends on if they're healthcare personnel or non-healthcare. And we are following the CDC guidance for that. So for healthcare personnel, the risk is very much dependent on whether or not the patient was wearing a mask. As you know, this disease is spread through respiratory droplets that are spewed out when people cough or sneeze. So if the patient is wearing a mask over their mouth, that blocks the spread of these droplets. Without a mask, those droplets come out and they fall to the ground within 2 to 3 feet. So anyone within 6 feet, to be conservative, would be at risk for exposure to those droplets for that person if they did not have the mask on. So healthcare personnel that would have cared for this patient, it would be different for the risk if that patient at that time did not have a mask or if they did have a mask. And then other risks. So the healthcare personnel, ideally, in taking care of a patient with COVID-19, would need to have standard contact precautions and respiratory or droplet precautions. And in this case, airborne precautions because they're in a hospital and that's available. But that means the healthcare personnel would need to wear gloves, a gown, a special mask called an N95 mask for healthcare personnel, as well as protection for their eyes so that they would not have those droplets touch the mucous membranes of their eyes. So, so it depends on to what degree the healthcare personnel had those elements of the personal protective equipment on at the time that they encountered the patient. So you can stratify them that way, whether the patient was or was not wearing a mask, and to what degree the healthcare personnel had all of those elements, the gloves, gowns, mask, and eye protection. And then for people who are close contacts with the patient that are not healthcare personnel, then it depends on whether they're in the home, whether they had interaction for a period of time within 6 feet, and or it could be low. Passing by someone in the hallway would not be a significant risk, and those people would not be quarantined, for example. Does that help?
Have you identified anybody who does need to be quarantined?
There are people, close contacts, as well as hospital personnel that will likely need quarantine.
Do we know the age range or age of the person who tested positive?
That is known. I'm sorry, I do not know that off the top of my head.
Do you know what state they were traveling in? Or states?
We're still gathering information on travel history, and so we don't have accurate information that we can, we can share at this time, confirmed information that we can share at this time.
Do we know if it's male or female?
We're not giving out personally identifiable information, but we are giving out information that's important for the public to know, for them to either feel safe or to take appropriate actions. Yes.
So, are you going to be giving public updates on how many people then have been added to quarantine because of this patient? To let us know how many people in that situation may have been exposed.
At this time on our website, we don't really have a category for that because our home quarantines have all been in travelers, but we'll figure out how to provide that information in a way that's meaningful and can be updated regularly.
And
Yes.
then how long, when did you find out about this particular case?
Well, this lab test was done by our lab and the public health lab overnight, and the results were reported this morning. Yes. Now, again, it's a presumptive positive. This is the first positive case that our public health lab has reported, and so as per protocol, we're having the CDC lab confirm it, but we're acting on the information as if it was a positive. I have no reason to suspect that it's not a positive, but we're calling it a presumptive positive till we have confirmation from the CDC
So you will
lab.
be announcing those as the tests come in, or is there some kind of time delay for the governor to know, or what's the procedure?
No, in this case, the results came to us this morning. There was already a press conference scheduled, and so that was a convenient time to go ahead and report the first presumptive positive.
Would you be reporting those as you know, or on a daily basis at the end of it? I'm just wondering about how the time lapse between reporting and public
Right.
test and public reporting.
We will likely be releasing the first positive ones that we get as a press release. If we get more, we'll probably have a site that people can come to and update, once or twice a day, whatever is appropriate. But again, for the first positive, the first few, we'll make sure that that people have that information and they're not having to go check. Right.
And all that.
Right.
And do you know the situation at Jefferson Memorial Hospital? Because the hospital, we're getting different reports about what's going on there. Like hospital says they're open, but you have to be tested, but the police say they're keeping people out. Just didn't know if you knew what was really happening.
I think the situation there is evolving rapidly, so I wouldn't want to speak having not been there this morning. So. Okay, we got one back here.
What's your advice for people with out-of-state travel plans in the near future?
That's a good question. The governor has provided some travel advice specifically focused around spring break. I think all Arkansans need to think through their I think all Arkansans need to think through their travel plans and be flexible. Get information on where you're traveling to so that you know, is that an area where there's ongoing COVID-19 transmission, and then consider how you're traveling there. Obviously going in your own car is a different thing than going on mass transportation. So I think people need to be willing to be flexible. A place that may be perfectly fine and safe now, you know, a couple weeks from now, may not be the best place to go as a travel destination. Okay, let's we'll go at the front and then we'll go to the back. Okay.
So I believe that it's been made public through memos to students, because that's how I got it, that CARC shut down today indefinitely at noon because of some exposure of some students to that patient at the hospital. Are we aware of any other institutional closures or threats that people need to be aware of until such time as you gather more information to know exactly what's going on?
Correct. It's a very good question. No, I'm not aware of any other planned closures at this point. In fact, their decision to close was an independent decision. You know, we are hoping that moving forward that we can, as a Department of Health, we can consult with our educational institutions, help them to make these decisions based on current epidemiology and what makes sense in terms of interrupting disease transmission. I do understand that sometimes when there's a lot of agitation and people are, you know, it's not possible to carry on as normal. There may be other reasons why an educational institution or a business may decide to close down temporarily that have nothing to do with the risk of disease transmission. But in terms of closures to prevent disease transmission, we're hoping that those will be done in consultation with us.
Who should a business or institution contact directly about that if there is a concern or a direct, you know, knowledge of a threat? And can you give us some idea as to how that works? Because you're talking about, you know, the basis being on epidemiology versus a concern of someone who's not a health professional, but how do we know, you know, what that looks like?
Correct. And you're asking about flow of information. When the Department of Health has information that would suggest that it would be strategic or important for a business, school, or other facility to close down for some period of time, then we'll communicate it with those the businesses, schools, or institutions directly. And our intention is to have those conversations, you know, before we would come to those decision points. Yes.
Flow of information. So as you're reporting, are you reporting up the chain to the federal government? And is that reflected on the coronavirus.gov website, the information from Arkansas?
Absolutely. We do report positives. Now, they may choose to wait to call it positive until their lab has confirmed that. And there's always going to be a delay between the information we have and when it's reported out on on the CDC's website, for example. But yes, we're in close contact with our federal partners.
I have a second question. Did the patient present to the hospital as a suspected case or can you give that information?
The decision to test this patient, I think, was based really on symptoms after they were admitted. This was not one of the patients that we had under investigation, for example, due to international travel.
So the patients under investigation went up today considerably to 14. So did that include people because of the test in Jefferson? Or was that just another jump in EUA?
No, anyone who we considered sufficient suspicion to test would be a person under investigation.
Right.
And so those were other individuals who had symptoms, and there was some reason to think that they could possibly be a case. But we've
unrelated to Jefferson, the patient in Jefferson?
Yeah, I don't have any information that those are related in any way. And all those other tests were negative. So, back.
Can you talk about the number of tests you're able to run right now, and will you be able to increase that in the future?
The issue of testing, I know, has been a very hot topic in the national media as well. We are increasing our capability within the state. And I should start by saying it's not just the availability of test kits. It takes a certain amount of time to prepare the specimen and actually perform these tests. We are ramping up our capacity, and we should be able to hit about 20 tests per day in our public health lab, which is not going to be enough to meet the needs of the entire state. There are a number of commercial labs that now have that capability, and hospitals and clinics can send specimens there, and they will report to us. We have electronic laboratory reporting from major labs, and we are also working with the hospitals to provide them information on how they can make those tests available to their patients. We would like, as we move on, for our public health lab to be focused on doing testing that helps guide our investigations and in some cases confirms positives that are done elsewhere. But we certainly will scale up in partnership with the private sector.
Earlier you said that this patient had severe symptoms. Can you elaborate more on the specific of the symptoms, just how specific? Can you get a little bit more specific?
Well, we won't give protected health information on the patient, just to say the patient was in an intensive care type of setting and was in isolation. Yes.
Dr. Smith, and I came in late, and I apologize for duplicating the question, but do we have any idea how this person may have come in contact with the virus? I mean, did they travel internationally or out of state? Were they at a convention? Do we know anything about that?
We're still gathering information on that. We have some information, but we need to establish its accuracy. At this point, we think the individual probably was exposed through out-of-state travel, but we'll have to confirm some details on that. Yes?
The students at CR, CR said it was the health department's recommendation that they be under the 14-day home quarantine. So was there something about what they did that indicated they were at risk?
Well, this is a very dynamic situation. Students both at CARC and UAPB, I know, are involved in clinical care at the hospital there. We are evaluating whether or who might have been exposed to the patient without full personal protective equipment. And as we identify individuals who might have been exposed, then we will have them do a home quarantine for 14 days, which is the outer limit of the incubation period for COVID-19. But that will be individually assessing the risk based on the contact they had with the patient, what kind of personal protective equipment they were using, And it's a very dynamic situation, and so I don't have that level of information right now to comment on any particular students or personnel. Yes, go ahead.
So I'm really interested in and concerned about that because obviously it's where I live, and you know, people are concerned and have already contacted me. And I didn't know until afternoon when the information was sent to the students. I did talk with the president. He said that there were 4 students who had contact with the person yesterday and this morning. In light of the fact that the person, I guess the diagnosis was not confirmed through the health department's test this morning, was protective wear mandatory for that person since they came in or were there because of there was a concern given the symptoms of that person, and also since they're UAPB students who also do clinicals, so I'm aware that there were 4 students who had that contact yesterday and today or this morning. Were there UAPB students who had contact as well? Obviously, with the concern being that without knowing and having that protective wear, people have since gone home to family members. Those family members have also had contact, and I'm not trying to create a stir, but people need to be aware that there's a concern so that they can self-quarantine if they need to. They can contact the health department if they need to. I mean, you know, my dad's a pediatrician. He could be seeing kids. He's 75 years old with heart disease.
Right.
So I'm personally concerned. I'm concerned for my constituents. I'm concerned for my community. So I just need as much information as possible to know what to tell people and what to do myself.
Absolutely. And it's important that all this information be thoroughly investigated, which is why we have a team down there, and we will continue to gather that information, make that information known. If an individual is referred for testing, then at least at that point, the hospital personnel should have been using full personal protective equipment. There's no point in testing someone for COVID-19 if you're not going to act as if they potentially had it. So, but
we don't know for sure.
But we need to see exactly what was done during the entire hospital stay before we can make those determinations for each individual healthcare worker or student or visitor, et cetera. So that takes time to sort that out, which we'll do very quickly. It's our highest priority to try and prevent or limit the spread of COVID-19 in our state, not just in Pine Bluff, but everywhere.
Right.
And so we'll be very aggressive in recommending self-quarantine or isolation, testing, and such. So again, at this point, we don't have evidence of transmission in the community. The average incubation period for COVID-19 is 5 days. There can be people who are incubating the virus for a few days before they show signs or symptoms. We'll need to watch them, make sure that they're not in contact with others during that period of time. We generally don't test people who are asymptomatic because the results are very difficult to interpret. Someone can be asymptomatic, you could test them and they would test negative, but that doesn't mean they don't have the virus. So we wait till they become symptomatic while they're in quarantine, and then we test them, and then if it's positive, then we know it's positive. If it's negative, then we feel much more comfortable that they're not infected. Back there and then up here.
The White House today said something about making information classified. Maybe the senator said something about this, I didn't hear. Is that affecting our information? Do you know exactly what that means?
I'm not familiar with what they said. It was at noon today, right?
Mm-hmm.
I don't know.
No,
Just didn't know if you've been told.
I'm not aware of that.
Some of the information you're able to.
No.
yes. Representative Love, and then
Dr. Smith, in talking in regards to, symptoms, are the symptoms of COVID-19 the same as, I would say, the symptoms of the flu or the symptoms of any common cold? I mean, would people experience any other symptoms beside those common symptoms that we would see in any other virus?
it's a very good question. With COVID-19, there's a lot of overlap, especially early in the course of illness, with many other respiratory viral illnesses like the common cold or like influenza. There does tend to be a difference, though, in that influenza people will tend to get sick pretty rapidly. And they may also have a lot of upper respiratory tract signs or symptoms like runny nose, runny eyes. With the COVID-19, what we tend to see is more fever and a dry cough initially, just sort of feeling bad, and it tends to come on more gradually. Now, most people who get COVID-19, they have mild infection or maybe no symptoms at all. But for the 15-20% who might develop more severe disease, those more severe signs tend to come on after several days, more towards the second week of illness, and they can manifest as a pneumonia, and then those patients may need hospitalization or even intensive care in the hospital.
So I'm confused about incubation and when you start to get sick. The incubation period is 5 days, do you say, after you may have it for 5 days before you have any symptoms at all?
The incubation period is the period of time between when someone is infected and when they show their first symptoms.
Okay.
And that can range. Typically, it'll range from 3 to 6 days. So after someone's been infected, they may not show symptoms until 3 to 6 days. In some cases, it can go longer. And that's why we allow a full 14 days to try and capture everyone who might have been infected. If they haven't developed symptoms by 14 days, then it's highly unlikely that they ever will.
In terms of the timeline, do you know when this person came back to Arkansas, when they started having symptoms and when they were admitted?
Yeah, I don't have that information at this time. That will be important information in terms of identifying contacts, and so that's why our team is down there now.
Bill, you talked the other day about the PPE, personal protective equipment that the hospitals should have and use and have in place and the plan. Is it too early to know whether they had that or whether they implement their plan as they had planned? Or will you learn something later on about best practices and what didn't go well and what did go well? Can you add anything to that?
At this time, we're still working to understand the course of the disease, the timeline, and so forth. So I want to be accurate in anything that I say. So I think it would be better that I not comment until I know really what the accuracy is of anything that I have heard.
We have time for 2 more questions, and then Dr. Dillahay will stick around to answer anything further.
How about 3? I see 3 hands up. So starting at the back and then coming forward.
I have a couple things. Should Arkansans be worried at this point? How can they prepare? And also, do you guys know the accuracy of the test?
Okay. Let me tackle a couple of those. I think Arkansans should be concerned and aware about COVID-19. I don't know that Arkansans need to be any more concerned or aware today than they were yesterday. We know that we've had many of the surrounding states have reported cases, and that there is a risk of COVID-19 coming into Arkansas, and so that remains the case. What we do know is that we have one presumptive case who is in isolation, and at this point we don't have evidence of spread within the community. But I think Arkansans need to be aware, keep themselves informed, and listen for guidance as it comes out. In terms of the test, we're The test that we use actually detects the genetic material of the virus. It seems to be very accurate. If it's negative, we're pretty sure it's negative. If it's positive, we will, because this is a new test for our lab, want to have that validated by the CDC's lab, but we're very comfortable that a positive result is likely positive. Does that answer your question?
Yeah, and then just how people can prepare.
I think people need to do a number of things. One is take measures to protect themselves. We're used to handshakes, but we need to move away from that during this flu season, and as long as we have the COVID-19 around. Try to wash your hands frequently or use gel alcohol sanitizer on the hands frequently. Avoid touching your face as much as possible. It's a hard thing to do. And if you're sick, don't go to work or school. And if you encounter someone who's sick, try and stay a healthy distance, 6 feet or more.
So if someone thinks that they have some of these possible symptoms, what do they do? I mean, obviously you don't go out in public and, you just call a doctor to kind of walk us through that.
Yes, I think it would be wise to call ahead to your healthcare provider and explain your concerns. Not everyone with mild symptoms needs to go see the doctor or go to the emergency department, but explain the symptoms and have an assessment by phone is a good idea. And then based on that assessment, it may be appropriate for someone to come in and get tested. Remember, there are many things that are much more common this time of year than COVID-19 in Arkansas. And so there may be other things that your healthcare provider justifiably wants to test for first, including influenza. There was a question there?
Essentially, it was kind of the same question that she asked, but it was just advice for the public now knowing that this case is in the state.
Yes, thank you.
So I believe that Arkansas got $6 million of the federal monies that have been made available to respond. Now that we know that Arkansas has been exposed, and in particular Pine Bluff has been exposed, and I know that we're in a wait-and-see pattern because you guys are still pulling together, accurate data so that we can know where we are. We're presuming or assuming, based upon what we know now, that there is not community spread. But if there is, then what happens? What kind of operation happens on the ground in Pine Bluff or here at the Department of Health? And in the meantime, how do we utilize those funds, or do we, in terms of prevention? Because now we've seen in the United States, I think we're up to 31 deaths and hundreds of cases, or over 1,000 I think now. It was like that in China before. It was like that in Italy before, where it was just, and I don't think we need to go into a panic, but I think people want to know, what are we doing to prevent this from spreading? Can we do anything? And if we see that this one case mushrooms into more, what can we anticipate in terms of utilizing the funds that have been made available as it relates to testing, prevention, treatment, whatever? And is some of that money available to help people economically? I mean, we see what's happening across the country with businesses closing and institutional closures and that kind of thing. I know that's a lot, but this was the last question, so I had to.
Right. That's a big question. I think it is important that we use all the tools available to us to limit the spread, slow down the spread of COVID-19 in Arkansas. I think we have a lot of advantages over what they had in China. We know a lot more about the virus. We have we've had more time to plan, and the fact that we had the first case in the United States was back in January, and this is now just the first case in Arkansas. We have been able to slow down the spread. We've not seen explosive increases in cases like they have in some other countries like South Korea or Italy. We'll continue to use those tools and other mitigation strategies to slow down the spread. In terms of the funding, there are, as you imagine with federal funds, there are allowable expenditures and there are ones that are not allowable. As far as I understand, there is no provision at this point for compensating businesses for lost revenue. This is mostly targeted towards evidence-based strategies for preventing the spread.
And what does that look like? So prevention, what does that look like?
Well, sort of like asking a doctor, how do you treat someone who's sick? It depends a lot on the details. In our case, we've got a wide variety of mitigation strategies that we can utilize. Some have been mentioned here. There may be times where it's appropriate to temporarily close down a school or move that education to more of an online format, or businesses, continuity of operation plans for both state government and private businesses. These are things that we can consider as the situation dictates.
I did want to ask about the funding, since you said yesterday you had a rough estimate of $8.8 million, and now they announced the $6.2 million. Is that going to create any problems in terms of having enough money?
Well, in public health, we're not used to having abundant funding, so we will make good use of what we have and then hope that we get more as we need it. Yes, was there another question?
No, mine was just an outline of that $6 million in federal appropriation or federal spending and where that's going to go towards and how we're going to best utilize that. And then I think, are you monitoring that? And then as we move through the fiscal budget hearings and fiscal session, that could be, there may or may not be a request to the General Assembly for additional revenues, but it just depends on the situation.
That's absolutely correct. Again, we had done some advanced work to try and identify what our costs were likely to be. We will look at the specific guidance with the federal funds and put as many of those requests into the rubric that they provide for us.
Real quick, you made the statement that it was expected for Arkansas to have a case, and now that we have a first case, would it be safe to say that you would expect that there would be other cases, especially with travel, and then not only that, but the way that the symptom develops? You're saying a person would be, it would take 5 days, but then once you identify that they do have it, 14 days. So in that period, there's a possibility that this one person, not specifically talking about the one in Pine Bluff, but any other case, that one person could spread, it could spread to multiple people before it's finally identified that that first person in fact has it, and therefore the challenges that you face in trying to slow down and prevent the spread of it. So then, would you be safe to say that you would expect other cases to come to light?
It's a very complicated question that you ask, but yes, I think it's likely that we will identify additional cases of COVID-19 in Arkansas, and it may be that there are individuals who have already been in contact with this patient who have been infected, and we'll find that out in the course of our observation and testing. I think that we are, I'm somewhat comforted by the fact that we had done 24 negative tests. Actually, if you add the ones from the private sector, 27 before we got our first positive. And these were all individuals who we thought were at high risk based on exposure and symptoms. And so it seems unlikely that there was lots and lots of it out there that we were missing.
Yes. Would you say that Arkansans are still at low risk of contracting the virus?
I would say that. We have one presumptive case in the state, and we've got a population of 3 million. But I think in Arkansas, we need to be vigilant, just like we always are for a whole variety of health threats. We need to continue to live our lives and to do our business, but we need to take precautions and keep aware of the situation so that we can take appropriate actions, not to underreact, but not to overreact either.
Thanks everyone for coming. They're still going to hang around to answer some questions, but we want to be
lights, I think.
That was State Health Officer Dr. Nate Smith along with Dr. Jennifer Dillahay with the Arkansas Department of Health addressing the state after this first presumptive diagnosed case of coronavirus in the state of Arkansas. With so much developing today, make sure you're keeping up with the facts. We will track any and all updates regarding COVID-19 and the coronavirus and address false reports you may have seen online. Just text the word FACTS, F-A-C-T-S, to 501-376-1111. President Trump will also address the nation about coronavirus tonight during prime time. Stay with THV 11 on air and online. We will have much more tonight at 5, 6, 6:30, and 10.